So I just finished up my first 2 weeks of PM&R residency, and one of those weeks was my actual first week on the inpatient brain injury service. And it's a really difficult transition to make at first, going from one specialty to the next. And so I want to talk today about a specific example that sort of highlighted that challenge of going from one field to the other, and then also talk about some of the highlights from my first week on PM&R residency. So as a lot of people would guess, the biggest difference between being on a medicine service and being on the rehab service is the general level of acuity of care and sort of things like vital sign checks and monitoring and that sort of stuff. And that's something that until you're actually forced into a situation where you need more frequent monitoring or need more intervention, it's something that you don't really think about. And so a specific example of this that happened to me my first week on the service, I had a patient who was hyperkalemic with a potassium of 5.8 one morning when I came in and checked their labs. So if I had been on a medicine service, it would have been, not that big of a deal. The patient could tolerate fluids, so I would have put in some IV fluids. I would have given him a low dose of an IV diuretic to help get rid of some of that potassium, and I would have rechecked later in the day. So I put those orders in at my computer. I go out to find the nurse to try to talk to her about the plan and then talk to the patient. And she looks at me kind of funny and says, well, that's going to take some time because the patient doesn't even have an IV. And initially I was like thrown off, like, what do you mean the patient doesn't have an IV? They're in the hospital. But when you think about it, they're on the rehab service. And the whole point of the rehab service is just that, to go through their rehabilitation. When patients come to us, everything from a medical standpoint is supposed to be stable and finalized in terms of the evaluation and the diagnosis. And so while we do have a lot of acute stuff that comes up that we have to manage, things aren't really normally that acute when you're on the rehab service. And so if a patient doesn't need an IV or have IV fluids or medications going, there's no reason for them to have an IV hanging out of their arm whenever they're going through their therapy sessions. Another example of this is the standard vital sign protocol on the rehab services only once in the morning and once in the evening. So if you want to see your patient's blood pressure in the middle of the day, you have to specifically ask for it and pull them out of therapy to have it done. So it was a little tricky at first because I had to sort of stop and think, okay, do I really need to call the IV team to put an IV in this patient, pull them out of therapy to give them fluids and to give them an IV medication? Or can I do other things that sort of fit well with their therapy sessions, but still take care of the patient and put their best interest and safety first? So I was able to just give him some oral Lasix. He was drinking okay, and so I just encouraged fluid intake. And, everything worked out okay. I checked the potassium later in the day and it was just fine. But it was still a little bit of a challenge at first to adapt to that change in the environment that you're in when it comes to managing acute things, because stuff still goes wrong on the rehab service, even though people are generally very stable. Now to hit on some of the highlights from this past week. So obviously it's been fantastic. I feel like my stress levels are really, really low right now. I'm just in general in a better mood and just feel happier about things now that I'm done with intern year and on to PM&R. In particular, I've had this new sense of motivation and desire to actually study and learn about things outside of the hospital. And that might sound crazy, but if you're not interested in internal medicine, it's really hard to motivate yourself to study for 30 minutes or an hour each night. But with PM&R, this is what I want to do. This is what I'm passionate about and interested in. And so it's a lot more exciting and easy for me to come home, read about things my patients have going on, look at research articles, read my review book. It's interesting, it's exciting, it's stuff I want to do. And so that's been really cool this past week. We also had the first afternoon of our anatomy and musculoskeletal didactic session this past week. So here at Mayo, we're really blessed because we have a really strong musculoskeletal and ultrasound curriculum. And in particular, we have this series throughout the first half of the year where each week we break down one particular joint or joint system at a time and go through basically everything you would need to know. So we'll even go into the cadaver lab at the medical school and we'll do a dissection on the joint that we're talking about that week. And we actually get to do the dissections as residents. It's not someone doing it for us. We're going in there with really as much guidance as we want or as little as we want, and doing the dissection to fit exactly what we think is clinically relevant. So pretty cool, right? I mean, it's not every specialty where you get to actually go into a cadaver lab and dissect the things out that you're studying about later in the day. So we learn the anatomy, we go through physical exam, and then we actually get to pull out the ultrasound machines and practice and learn about how to do ultrasounds of the joints that we're talking about. And I would definitely say that's one of the strengths of the program here at Mayo is our ultrasound curriculum and our just general MSK stuff. And so to actually have been exposed to that for the first time after being here for a year but not getting to do any of it, it was like being, a kid on Christmas morning. I mean, it's so cool. We had a room full of like 6 or 7 super fancy ultrasound machines, a number of our faculty that do these things every day. And we had like 2.5, 3 hours to just sit there and play around scanning, different joints on ourselves, on other people, really just initially getting the hang of how to use the ultrasound machine, how to hold it, how to make adjustments on the setting and things like that. As we progress through the year, we'll of course get more and more in depth, and then we repeat this didactic session each year. And so each year you can kind of focus on a different part of it. So for the PGY2s like myself, really anatomy is the big focus of the year. And so for us, it's more so just getting familiar and comfortable with the anatomy, knowing the nerve roots, the innervations, the actions, the origin insertions, all of that of the muscles, and then the clinical relevance of it. Whereas next year and the following year, when we do this type of course, it's a lot more about the ultrasound techniques and the physical exam techniques. Some other things going on. So I wasn't on call this past weekend, but this weekend coming up will be my first weekend on call. And so here during the week, the senior residents take call, but then on the weekends, it's the juniors like myself. So I'm paired up with the junior on the other inpatient team, so the junior on the spine service, and we both come in each day on the weekend, so Saturday and Sunday, to round and see our patients. But then we can go home afterwards. But then while we're at home, we carry the pager for all of the services, splitting up the weekend. And so, if things go wrong overnight, then we have to come into the hospital and help take care of things. If someone needs to be evaluated, we come back in. And it doesn't happen too often. I'd say most of the senior residents would tell us on average, maybe 4 or 5 times throughout their training, do they actually have to come back into the hospital. But it's still that stress of being on call. You're still responsible for the patients. So that's going to be exciting. Pretty cool experience that I'm sure I'll be looking forward to sharing with you guys in a future video. So that's it. First week of PM&R residency is in the books. It's awesome to be done with internal medicine, have really turned a new chapter, starting off in something I'm actually passionate about and excited in. I'll definitely have a lot more videos focused on PM&R on this page going forward, since that's going to be, the majority of my life for the next 3 years here in residency. Still going to plan on doing some of the general medical education, medical school type stuff along the way, so don't worry about that. But in particular, if you're interested in PM&R, then definitely subscribe to this channel, because there's going to be a lot more content specifically focused on physical medicine and rehab as we go forward. Thanks as always for watching the video, everybody. I really appreciate it. Let me know your thoughts in the comments below, and we'll talk next time.